What exactly goes wrong in molar pregnancies like H-mole? Why in complete molar pregnancy we don't get any fetus, but in incomplete molar pregnancy we do get some form of fetus? What is the exact science behind this? Why instead of a normal fetus development we get some grape-like tissues? These are the few questions which I'm going to answer in this short session on H-mole. And basically I'm going to discuss two principles. If you understand these two principles, it becomes very easy to connect, correlate, and understand the concepts behind the H-mole and the gestational trophoblastic diseases. Now, one thing you need at the beginning, I need to tell you that gestational trophoblastic disease means that abnormal proliferation of trophoblastic tissues, which normally develops into placenta. Trophoblastic tissue is basically normally develops into placenta. And abnormal development of these placental tissues are occurring in gestational trophoblastic diseases. Now, I'm going to tell you two principles. Number one principle, which is very, very important to understand gestational trophoblastic diseases, is this, that in a fetus, in a growing baby, what is happening, that we are getting contribution from the father's gene and from the mother's gene. Now, father's gene basically contributes more for placental development, and mother's gene basically contributes more from the fetus development. So father's gene, paternal genes are contributing more for the development of the placenta, remember this concept, and mother's gene for fetus. And second principle is this, that for a normal growing fetus development, what do we require? We require a balanced contribution of the genetic material, both from the father or from the mother. Now, if you understand these two concepts, it's very easy to understand what goes wrong in the molar pregnancies like H-mole. In H-mole, what is happening? This balance gets disbalanced. H-mole in this fertilized ovum, what is happening? That we are basically getting more contribution or entire contribution from the father's genomic material, genetic material. No contribution in particular in complete molar pregnancy from the mother's genetic material. So what would happen, as I mentioned earlier, the father's gene mostly contributes in the development of not of fetus, but of placental tissue. So only placental tissue, particularly the trophoblastic tissue, they would develop in those pregnancies. And these are called complete molar pregnancy. You know, complete molar pregnancy happens when one empty ovum, where there is no maternal chromosome or the maternal chromosomes are inactivated, they get fertilized by one sperm, and the one sperm can reduplicate its genetic material. So the point is that there is no maternal chromosome is seen in the complete mole, H-mole. And that's why in complete H-mole we don't get any fetus. Because as I mentioned you, as there is no maternal genetic material, and maternal genetic material is the thing which contributes to the fetus development. That's why we are not getting any fetus in complete H-mole. But in incomplete H-mole, what is happening? In complete H-mole, usually we get some contribution from the mother's genetic material also. Because in incomplete H-mole, what happens? When a ovum which has maternal genetic material get fertilized usually by two sperms. So in incomplete H-mole, we typically get 66.66% contribution from the father's genetic material and 33.33% from the mother's genetic material. It's not equal, but as this is more skewed towards the father's genetic material, so we are getting excess development of the trophoblastic tissue and placental tissue. And as mother is also contributing some, so we are also getting some fetus development, but the balance is not there. So the fetus is basically cannot function as a normal fetus. So that we get a malformed fetus in the incomplete H-mole. So this is the reason actually that why in complete H-mole we get no fetus, and in incomplete H-mole we get some malformed fetus. And the entire concept of understanding of H-mole basically runs on two principles. The two principles I told you, that in a healthy fetus development, we require a balanced contribution from the father's genetic material and the mother's genetic material, which is not happening in a H-mole. That is the sole reason. And father's genetic material mainly contributes to the placental development, and mother's genetic material basically contributes to the fetus development. All these H-mole diseases occur because this balance gets disbalanced. We get more contribution from the father's genetic material, and that's why placental tissue, particularly trophoblastic tissue, proliferates, and we get this gestational trophoblastic diseases like HMO. That is the fundamental principle behind all these diseases. I hope this clears all these doubts. Thank you so much.